archaeologists analyzed in the laboratories fragments from ancient altars covered by sandstorms or volcanic ash. A surprising result caught my attention. Along with the fragments of the sacrifices, which sometimes also contain human remains, there are traces of plants with psychoactive effects. In fact, traces of drugs. The smoke of these plants produced a euphoria to those present, which they believed was due to good will of gods. The priest lied on purpose while breathing the smoke from the altars installed addiction. Gradually, the repeated return to these altars brought enormous financial income to the priests. Nothing new. And today, drugs offer the illusion of getting rid of problems, promise a false state of well-being, install addiction, and begin the gradual destruction of the body and irrevocably the mind. Drugs destroy lives and ruin families. Welcome to Steps in Recovery, a program where we want to convey hope to people who struggle with addiction, bring hope to the families, and most of all, help the public opinion and help policymakers to know how to get involved in providing resources for preventing this catastrophe. I am MargiAnne, a licensed professional clinical counselor, and I have the joy and honor to have my guest today, Miss Marissa Partee. Welcome, Marissa.
Thank you. Thank you for having me.
Marissa is a behavioral health specialist and addiction counselor, and I have the privilege of working with her on the same company for some time. And we will discuss today about what could be done in Romania in order to help people from there develop programs. Welcome to the team. This is something I learned since working in recovery. When you say team approach, what do we need to know? The benefits of this.
When I think and consider further about team approaches and the effectivity that we can reach for somebody who is reaching out, trying to gain services, I think it is the most beneficial approach to work collaboratively with different various specialists that have different insight and knowledge that can bring together a grander approach to help that client, to really help service all their needs collectively as a team.
And just to introduce you to our Romanian program, I was talking with my guest, psychiatrist Andreea Mănescu, that the results in recovery are so disappointing because people still use the model in recovery which was used years ago without team approach. I'm so glad I have you. What I noticed from our working together was the special relationship you have with the client, therapeutic relationship.
Yes.
Tell me something about like addiction counselor-client relationship.
So I find myself very successful in what I call building rapport with my client. I use a lot of motivational interviewing techniques to help them recognize that I am not trying to push them towards something that they might not be interested in or ready for, but something that they are considering. So those motivational interview skills really help me identify with that client, with me, what they're willing to change, what they're identifying as a problem in their life, but I allow them to look at that and I support them through that process. And in that, that's when I happen to build that rapport. They feel, oh, someone hears me, I feel supported. And from there, a lot of work gets done.
It seems a lot of Rogersian approach where you are there for the client. You don't come like the expert.
Yes.
I am the expert, you should do this, you should do this.
Yeah.
And they come with a lot of burden. They are pushed to come there, they are humiliated by loved one or society. But here they have a very empathetic counselor.
Yeah, and an open space that really allows them to disclose things that they've never felt comfortable disclosing, but with those motivational approaches and those questions, you help pull that out and you help allow them to put it in their own words, and it's just more effective in them recognizing, oh, yeah, that might be a problem, and then asking, what can you do about it? What can I help you do about it?
And I remember, because everything comes from my practice and working with you, I remember clients saying, Marissa said, talk with Margie about this.
Yes.
What was the secret?
So another thing too is I try really hard and I make sure to stay in my scope of practice. I know my limitations as a counselor and as a behavioral health specialist. I know when something becomes more appropriate for the therapist to be involved in, and then I help redirect that client to make sure I don't overstep or open up something with them that I can't help them close when they leave. It would put them in a high-risk situation. So I'm very mindful about the type of discussions I have with the clients and when to redirect so that they know who to appropriately have that discussion with.
I might say that I see a lot of hope with counselors having this understanding about scope of practice, scope of competence, and creating the team.
Exactly.
Because I have experiences with counselors who said something and I need to come and work double with the client, because the whole point here is to let the client understand the process, because addiction is a process, recovery is a process, and relapse is a process.
Absolutely.
And we'll go over. There is this so-called concept of self-disclosure. It's about my relationship with my client as a therapist, but also is the same because we talk about the same therapeutic relationship. Something about self-disclosure. What is this in your capacity, and what were your experience with clients?
Self-disclosure can be very sensitive. So you have to be really mindful about the type of things that a client's willing to disclose with you, and then when it's appropriate to share that with another team member that you're collaborating with. So that way it doesn't break or destroy that rapport you've built with that client. So I always bring awareness to the client that, you know, that's very insightful information. Are you okay? And I ask them if they're okay with me sharing that with the assigned therapist, with whoever that might be the appropriate person to be. It could be a physician, their doctor. But, you know, I let that client know that that's something that I would feel is most appropriate as a next step. But I also allow them to feel like they're involved in that decision too. And more than likely, I get told that they are understanding where I'm coming from, and they give me that permission to go ahead and share with who I need to.
And what we know, the best one is about self-disclosure. Self-disclosure is about helping the client understand and not to have this as your own therapy. I
have to make sure. I think that's probably one of the hardest things in just the field itself is really minimizing, because it's going to happen regardless. We're human beings. We have to be mindful of transference, counter-transference, because it can go both ways. And just making sure that we don't attach ourselves and personalize the information that we're getting working with our clients, which can be tricky and hard. It can be.
Wonderful. Thank you for honesty. Because it's about helping client develop boundaries. Because all of these people will come, and because of their problems with self-regulation, the issues with boundary is like nowhere. And here you are.
There's a lot of issues that really work at the same time as other things that they're working on. Codependency and boundaries are a really big factor we see in addiction recovery. And it does come with the lifestyles they're living. You know, they just naturally, the lives they're living, they're lacking boundaries with others and self. So that's just part of the work and another whole process.
I remember one of my clients said, Margie, I thrive in chaos. I was like, what do you mean? It was in my beginning of practice. I said, what do you mean by this? No structure, no chaos. And this is why we'll see that in recovery, the point is for us as professionals to create the structure
Yes.
to enforce rules and provide
Yeah.
affirmation.
And I'm
validation.
I'm absolutely familiar, even personally, with thriving in chaos, because for a lot of people, that's what their entire lives were. So if they're entering a family with addiction problems already, they're already entering chaos, and that's their norm. Until they get some help and they get, some professional services to help them recognize this is not normal. And then the real work starts.
Yeah, and I'm so glad to have you here because you work also as a case manager.
Yes,
and
I
we
did.
see that when we talk about recovery, it's not just medication, a little bit of therapy. It's a whole world. Something about the role of the case manager, if you want to share.
The case manager factor in recovery is fundamental to me. People are in a process of really trying to get so many things established for themselves. It's that foundation they're building so they can maintain their recovery and success. Case management's vital to that. The case management is what I like to call linkage to other services, other necessities that are just required in life. So following up on doctor's appointments and having somebody help you with that, because somebody in addiction more than likely doesn't really know or have the skills on how to do those basic life tasks that are required in our daily living. So the case manager really helps build all of those linkages as a resource. So they help with doctor's appointments, they help with identification necessities, Social Security, driver's license, everything that's really going to help them get on their feet so they can sustain, get a job is a big part of it, get back in school. It's a big linkage process.
Yeah, and when we talk about this for our Romanian audience, they will know that recovery doesn't mean 10 days in a hospital, doesn't mean 90 days in a program, because the minimum, we'll talk about 90 days is the minimum. It's about recovery.
The sustainability of all of it.
Exactly, and this is why we need a person who is in charge of helping with all of these resources. Okay, coming to the program, we started. We admitted a client, and the client will say, I really want the substance. I really miss it. Let's say we finish with chemical detox.
Okay.
And now, welcome to the world. What the clients need to know, what the families need to know, what other professionals need to know about cravings.
Cravings is a very general common phenomenon that we see occur in recovery. We can see cravings occurring from the start of trying to get sober to a year of being sober. So I've seen it last, quite a bit, but the importance is knowing what your craving looks like and how long it lasts. So cravings for me as a counselor are very helpful. So when a consumer comes to me and claims they don't have a substance problem, they can just stop. They can do this on their own. We like to see them go through that detox period, and we like to see them go through those first 30 days, but their insight that they start to gain on cravings is necessary for the clinician, because that's the information we need to help support and show that client, could this be an addiction? Because if you weren't addicted, you wouldn't have these symptoms that we're seeing that occur in the craving stage. The irritability, the anger, the aggressiveness, just a lot of the emotional disturbance, and we see some physical disturbance as well in the symptoms. But that for me is very helpful, because then I can sit down with the client and let them know this is what you're experiencing.
This is normal.
This is what craving looks like. But then that allows me to help them recognize maybe that use was more of a dependence. Maybe this is your body telling you, no, we were dependent on that and I need it again now. And that's why you're at this state.
We are talking about the body homeostasis.
Yes.
The body was used with something, and now it doesn't change overnight. It is a lot of time, and we need people to be there for education and be there to help. Interesting how long the cravings are.
Yes.
Because this is the question I'm trying to have many clients answer.
Cravings, it's going to come down to you as the client taking the time and having that clinician and support with you, taking the time to time it to see the duration of it. So there's an exercise that I love using at the beginning of recovery with people is it's called urge surfing. So it's a theory about you being really mindful of knowing when you have an onset of a craving and literally putting on a timer to see how long it lasts.
Interesting.
And then see if there's a pattern every time that occurs. And we recommend journaling that and then going over that with a clinician to see, okay, you know, I noticed the other day I started to crave. I timed it. It was about 30 minutes of a craving. That insight is so valuable because then we know in that 30 minutes, now that client can implement something early, right? So they can use one of their coping skills within the first 5 minutes they're noticing their craving to see if it intervenes and minimizes. Because more than likely what we see is that craving minimizes with coping skills and healthy distraction.
Okay, it's part of recovery?
Yes, always part of recovery.
And it's a science? It's nothing random?
No,
Everything
it's within the brain, biological. We see it with the reward process. We see it just with what we find on information regarding the disease of addiction. It's definitely in the brain.
Yeah, and we know you already said this is about timing.
Timing.
And something I learned since working in this field is not just chemical, like desire. It's like it's not a desire just based on the chemistry. It's more than this crazy. It's about emotional turmoil. Is there. I feel like going there, and this is why journaling and having this like emotion crisis cycle and put together this cycle with the cravings. You'll say, hey, it started with this, and this is why we need this collaboration. We really need to.
And it is going to be different for everybody. You know, the drugs, for the most part, do have different effects on our physiologies. But I think the biggest component, too, is the trigger. So it's what occurred for that craving to happen.
Yeah,
and
we'll move immediately to the triggers. And this is why it's so important to be in a program, to have psychiatrists, because there is something underneath. Emotions are based on chemicals.
Yes.
And in this time when people stopped using, there is an unbalance, is a chaos in the brain chemistry, and you cannot go without extra support.
You can't. You will set yourself up without the most support you can get possible. I see it happen a lot. People think like, oh, I only needed to get sober. They get sober, and here comes the flood of emotions that they haven't felt for who knows how long. And that's overwhelming.
And thank you for pointing this, because here we are addressing toward Romanian people. We are Christian. Romanian, let's say, people are Christian. And there are programs who said we rely on God, we believe in prayer, we'll pray, and God will help. And I would say thank you very much. Prayer is one intervention. Meditation is another intervention. But the physiology, we need help. We need a physician, especially in addiction medicine.
Oh, yes.
Psychiatrist to be there.
Yes.
Let's talk about cravings, triggers.
Triggers.
Tigers. I learned from clients is something like coming. I say, use this concept of triggers, tigers.
Yes.
It's coming to attack you.
Exactly. And I've even heard approaches with that, with the image of a bear. So triggers, again, that's something that's going to look very different for everybody. We all have different sensitivities. We've all had different life experiences, thus creates triggers. When we face triggers, we have to, as a client, they have to be very mindful in identifying specifically, oh, that's a trigger for me. Because the more that they can identify their triggers, the greater chance they'll be able to intervene whenever they face that trigger again. So that insight and that knowledge of personal triggers is very powerful.
And this is why therapy is helpful, because therapy means looking inside and discovering who you really are in this moment, and know how to manage yourself by yourself and not by using the substance, the person, or whatever behavior.
Yeah, and when I think about the component of therapy, when I see people cutting themselves short on what they need to be successful. They'll try to go to their peers for therapy. They'll try to go to other aspects of social support for therapy, and it's not as effective.
Yeah.
Therapy is a whole different approach. It's a safe space. You don't have that same history with other people. It's just the most appropriate component when you're going through triggers.
Yeah, and this is why it's a special education about triggers, and we learn about internal triggers, external triggers. It's a lot of self-searching.
It is a lot.
Self-searching and awareness, and be mindful about.
You have to, because at the end of the day, they say we are our own best experts. So we do have to take that time while in recovery to really gain insight on ourselves and independently. So mindfulness is very vital to that. We do have to become mindful about all the information, because we're going to be expected to share that with a professional. So it's really important to be mindful.
Cravings are part of the process.
Yes.
They said the brain is going through all kinds of changes. We need extra support with the medication prescribed by professional in the field, not by somebody who tries to, let's try this, let's try this, let's try this, which is something I hate. And of course, there will be some medications who helps with the cravings, depending on the chemical you are addicted to. In the same time, as a counselor, how you help the client manage or deal with the cravings. You already said something, but if you have something more.
You know what? I find a lot of ease in working with a client that is open to having the psychiatrist involved, because I think it is beneficial in those first few weeks and that month of recovery. I think getting psychiatry support is very helpful, because it does ease and bring down some of that emotional disturbance that might impact your success. You know, some people get very overwhelmed with everything they're feeling for the first time in a while. So of course they want to leave and self-medicate, but an alternative and an approach is having the psychiatrist involved. So I kind of support and encourage, but also respect someone's autonomy. But I do encourage them to make sure that they seek psychiatrist options, and then we explore what that could look like. And then that's when I help with the linkage. I get the case manager involved. I kind of get that process going, so I'm holding them accountable.
Yeah, and we, again, to the structure. You structure the day, you follow, you develop a new lifestyle.
Yeah, the
with
routine.
New skills.
Yeah,
exactly.
The routine is very, very vital as well. A lot of them haven't had a very healthy routine in their daily lives. So as a counselor, having a very specific schedule that they're attending to, whether it's group from this time to this time, an open break for them to handle something that they know they need to do, but then really establishing that and holding them to that whole routine, that it's definitely life-changing for a lot of people.
Because the brain, we are functioning, we are people of habits or creatures of habits. And this is like minimizing the stress. Because if you are working or living in chaos, it's a lot of turmoil in your brain.
Yeah, you're right, because that can even be an early warning sign that's identifiable. So if we're noticing lack of routine again, lack of structure, we in a way kind of identify that as addict behavior, because it's going back to old routines. There is no routine. So that's we identify that as an early warning sign.
Yeah, and we talk in another session with Dr. Andrea about withdrawal symptoms, post-acute withdrawal symptoms, because you have this, and we talk about cravings connected with emotional state of mind. Now you have it. Psychiatrist be there, addiction counselor be there, therapist be there.
Yes, with the withdrawal symptoms, the psychiatrist involvement is very beneficial.
Yeah, it's not just praying, relax, calm down, will go.
Yeah.
Time will go.
It helps with the symptomology they're experiencing. Yeah.
And this is the point. It's not, we said in another session, this is not a choice. This is a brain disease.
It is.
Plus social disease, plus emotional.
And choice disease, it's an impairment of choice, you know.
Yeah, so complex, so draining.
It is.
For everybody in the team.
It is.
For people to know that when you work in this field, is exhausting, but it's so rewarding.
It is.
I might say, I'm so glad
Yeah.
to see the patient when she or he leaves to see, wow, it is me? Because they look at the picture and say,
Yes.
it was worth it.
Yes.
Dear people who struggle with addiction, there is hope. There is so much hope. But you need to find a team, and you need to be able to move on to work, because recovery is a work. This is your work. Because people said, oh, I need to go back to family, I need to go back to work. I say, hey, stop. This is your work. In will move, and next session we'll talk about the relapse process. But for today, I thank you so much.
Thank you.
Because you bring us a lot of knowledge and experience, and I hope our Romanian audience will get a lot.
I do too. Thank you, Margie.
My pleasure. We are glad that you followed our dialogue today. On our part, it is a way of extending a helping hand to those who listen to us, presenting recovery as a serious, logical, scientific, and a very possible action if it is followed step by step. If somebody is watching us right now and is struggling with addiction, I'm telling you, do not despair. There is hope for you. God is there. He's ready and able and willing to help you anytime. I am MargiAnne Isaia, and together with Marissa Partee, we invite you to the future presentation.